Have you ever looked in the mirror one morning and noticed that your ankles, feet, or even your hands seemed puffier than usual? Sometimes the reason isn't too much salt in last night's dinner or standing all day, but rather a small pill you take every morning. Amlodipine, one of the most widely prescribed medications for high blood pressure and angina, is celebrated for its ability to keep blood pressure under control. Yet alongside its benefits, it carries a rather visible and often bothersome side effect: peripheral edema or swelling in the legs, ankles, or hands. This isn't rare. Many patients describe the feeling of shoes suddenly becoming tighter or socks leaving deep marks after just a few weeks of treatment. Some even worry they've developed a new illness. But in reality, the swelling is tied directly to how amlodipine works on the blood vessels, and there are scientific reasons behind it. In today's modern medical landscape, amlodipine remains a silent hero in millions of prescriptions worldwide. But to truly benefit from it, without being troubled by this side effect, we need to understand why swelling happens, who is more prone to it, and how to minimize it. This story isn't just for people currently taking amlodipine, it's for anyone who wants to better understand their body and how medications interact with it. Because once you grasp the underlying mechanism, you'll see that swelling isn't necessarily an enemy. Sometimes it's simply a signal to adjust a few things. So, how exactly does amlodipine cause swelling? And what does it have to do with the intricate network of blood vessels that nourishes every cell in your body? This video is based on peer-reviewed research and information from the Mayo Clinic, Cleveland Clinic, New Hampshire S, PubMed, and the FDA. This is for educational purposes only and not medical advice. Always talk to your doctor before making any changes to your medication. To understand why amlodipine can cause swelling, we first need to look at the cast of characters involved the drug itself, the circulatory system, and the way our blood vessels manage fluid balance. Amlodipine belongs to a class of drugs called calcium channel blockers, CCBs. More specifically, it's a dihydropyridine CCB, designed to relax the smooth muscles that line the walls of arteries. This relaxation widens the arteries, a process known as vasodilation, which makes it easier for the heart to pump blood and lowers blood pressure. Here's where the twist begins. Arteries and veins don't behave the same way under amlodipine's influence. While the arteries dilate significantly, the veins remain relatively unchanged. That difference matters because veins are responsible for returning blood back to the heart. When the arteries widen and blood flows into the capillaries more easily, but the veins don't expand to match, a traffic jam of fluid can occur. The result? Increased pressure inside the tiny capillaries forces some of the fluid out into the surrounding tissues, particularly in the lower extremities where gravity is strongest. Why the legs and ankles? Think of your body like a city with an uphill water system. Your legs are the low-lying neighborhoods. Water, or in this case, fluid, tends to pool there unless it's actively pumped back. This is why many patients notice swelling more in the evenings after being upright for hours than in the morning after lying down. Other contributing factors. Dosage. Higher doses of amlodipine, 10 mg daily, are linked to more frequent and pronounced swelling than lower doses, 5 mg. Age. Older adults may be more susceptible due to less efficient venous return. Other health conditions, heart failure, kidney disease, or chronic venous insufficiency can worsen the swelling. Lifestyle. Long periods of standing or sitting without movement can amplify the effect. And yet, here's the important thing. This type of swelling is usually not a sign of organ damage. It's a local fluid shift, frustrating, yes, but typically harmless in itself. The real challenge is comfort and quality of life. Now that we know the who and how, the next question is, what happens when this side effect becomes significant enough to interfere with daily life? How do patients and their doctors respond to it? For many patients, The first signs of amlodipine-related swelling are subtle, a faint indentation where socks press into the skin, or a faint heaviness in the legs at the end of the day. At first, it's easy to ignore, but for some, this swelling quietly grows into a daily obstacle. I remember speaking with a retired teacher who had been on amlodipine for 6 months. "I used to walk to the market every morning," she told me, "but lately my ankles look like they belong to someone twice my size." She wasn't in pain, but her shoes no longer fit properly, and the swelling left her self-conscious about wearing skirts or sandals. Another patient, a 4 or 5-year-old office worker, noticed that by mid-afternoon, his legs felt as though they were carrying lead weights. "It's not just cosmetic," he explained. "It's like my body is telling me to sit down when I can't afford to." This physical discomfort often led to reduced activity, which ironically can make swelling worse. The tipping point usually comes when the swelling starts interfering with normal life. Shoes that used to fit comfortably feel tight by evening. Prolonged standing or walking becomes more tiring. The visual change causes social discomfort or worry about underlying health problems. At this stage, patients often return to their doctor, wondering if something is wrong with their kidneys or if they're developing heart trouble. And here's where clinical experience matters. Recognizing that the swelling is a known side effect of amlodipine rather than a new disease can prevent unnecessary anxiety and costly tests. How doctors respond at this stage. They may lower the dose of amlodipine to see if the swelling improves. They might switch to another blood pressure medication or combine amlodipine with another drug like an ACE inhibitor to balance its effects. They'll often give lifestyle advice, more walking, leg elevation, compression stockings to help counteract the swelling. But the real challenge is finding that sweet spot, controlling blood pressure without sacrificing comfort. It's a balancing act between the medication's benefits and the patient's quality of life. In the next part, we'll explore what happens after these adjustments are made and how different people and even whole communities adapt to life with this side effect. When adjustments are made, whether lowering the dose, switching drugs, or adopting new daily habits, the story doesn't simply end. For many, life after amlodipine swelling is about learning how to live with the change rather than erasing it completely. Some patients find that lowering their dose from 10 mg to 5 mg brings swelling down to a barely noticeable level, while still keeping blood pressure under control. Others discover that pairing amlodipine with an ACE inhibitor or ARB reduces swelling significantly, thanks to these medications' complementary effects on blood vessels. Daily life adjustments become part of the routine. Leg elevation. Putting feet up for 20-30 minutes in the afternoon can make evenings more comfortable. Compression stockings, a discreet but effective tool to keep swelling in check. Movement breaks. Standing up and walking for a few minutes every hour helps the leg muscles pump fluid back toward the heart. Beyond the individual level, there's also a cultural and healthcare dimension to this side effect. In some communities, swollen ankles are quietly accepted as a normal part of getting older or taking blood pressure medicine. Friends and relatives might even offer home remedies from herbal teas to salt baths, each with their own stories and traditions. In the medical field, awareness campaigns and patient education play a big role. Doctors are now more likely to mention the possibility of swelling before prescribing amlodipine, so patients aren't caught off guard. Pharmacists often reinforce the message, advising people to monitor their legs in the first few weeks of treatment. Interestingly, research shows that when patients expect this side effect, they're less anxious about it and more likely to stick with their medication, especially if they know it's harmless in most cases. It becomes a manageable quirk rather than a mysterious threat. But even with knowledge and adaptation, a lingering question remains for many. Is there a way to fully prevent this swelling without giving up amlodipine's benefits? In the next part, We'll explore the lessons learned, the strategies that have stood the test of time, and the lasting value of understanding this side effect, not just for the individual, but for the future of hypertension care. Living with or managing amlodipine-related swelling often leaves patients and doctors with more than just a medical adjustment. It offers lessons about the body, the importance of communication, and the value of a holistic approach to healthcare. Lesson 1. Knowledge reduces fear. The moment patients understand why swelling occurs, it stops being an alarming mystery. Knowing it's a common, generally harmless side effect helps people stay calm and make informed decisions, instead of panicking or abruptly stopping their medication. Lesson 2. Every body responds differently. Two people on the same dose of amlodipine can have completely different experiences. One might notice barely any swelling, while the other struggles with significant fluid retention. This variability reminds both patients and clinicians to tailor treatment plans rather than using a one-size-fits-all approach. Lesson 3. Prevention is better than reaction. Simple measures like regular movement breaks, reducing prolonged standing, wearing supportive footwear, and monitoring leg changes can help minimize swelling before it becomes troublesome. For those at higher risk, combining amlodipine with other antihypertensives can sometimes prevent fluid buildup altogether. Lesson 4. Communication is part of the cure. When doctors explain side effects up front, patients are more likely to trust them, report changes early, and stick to treatment. In the long run, this trust improves blood pressure control and reduces the risk of serious cardiovascular events. The lasting legacy of understanding amlodipine swelling goes beyond the single medication. It reinforces a principle that applies to all of medicine. A treatment's success isn't measured only in lab numbers, but also in how well it fits into a person's life. Comfort, dignity, and quality of living matter just as much as disease control. In the next part, we'll bring the journey full circle, summing up what we've learned and leaving you with one lingering question. Is there more to the story of amlodipine swelling than we've uncovered? We've walked through the story of amlodipine swelling from its quiet beginnings to the moment it becomes a concern, through the adaptations, lessons, and the values it leaves behind. Along the way, we've seen that what may seem like a small side effect can ripple through daily life, reshaping routines, habits, and even patient-doctor relationships. But the story doesn't truly end here. Research continues into finding ways to preserve the full benefits of amlodipine without the drawback of swelling. Newer calcium channel blockers are being tested, and combination therapies are becoming more refined. One day, managing high blood pressure might come without the trade-off of fluid pooling in the legs. There's also a growing focus on personalized medicine using genetic information, lifestyle factors, and detailed health history to match patients with a medication most likely to work for them with the fewest side effects. For some, that might mean a perfect fit with amlodipine. For others, it could mean a different path altogether. Beyond science, this story serves as a reminder of something deeply human. Health is not just about numbers and charts. It's about feeling at ease in your own skin, being able to move freely, and living life without constant discomfort. Swelling may be a side effect, but how we respond to it with curiosity, adaptation, and persistence can turn it into a source of understanding rather than frustration. And yet, one question remains. If we fully prevent swelling, will we lose the subtle early warning signs that sometimes alert us to deeper changes in our circulation? Perhaps that's a chapter for another time.